Hi, I'm Dr. Schmidt. Thanks for joining me. Today we're going to be talking about Botox. Botox is a wonderful drug. It is the single most popular cosmetic procedure done in the United States, by far and away. The second most common are soft tissue fillers, which we've discussed in another video, but this beats it by about 7-fold. Botox is used for smoothing fine lines and wrinkles, typically of the upper face. It has a lot of other uses. We will use it sometimes if people are sweating too much. You can use it for people who have migraine headaches. You can use it for people who have TMJ. But for cosmetic uses, we will typically use it in the upper face. Sometimes we use it around the mouth, but I reserve that for people who have really very early aging changes around the mouth, because those lines can be very tricky. The way that Botox works is it makes muscles relax. That's all. It doesn't fill things, it doesn't lift things. All it does is make muscles relax. Now we can take advantage of that on the head and the face, particularly around the eyes, to achieve a little bit of a brow lift. One of the things that happens through the aging process is that your brows get droopy. People might say that you look tired, or people might say that you look angry because you've developed these frown lines all the time. Well, we use Botox to relax all of that. Botox lasts for about 3 months. A treatment really only takes a couple of minutes. Typically you won't see any effect for about 3 to 5 days, and it sort of comes on gradually. And at 2 weeks, generally it's at its maximum. There are other products available on the market that do what Botox does. They generally all work in a very similar way, but different ones will have a quicker period to onset or a slower period to onset, or different ones will spread a little bit more than others. In my practice, we use Botox the most. Botox comes in a little vial that we keep in the refrigerator. That's what it looks like. It says Botox on it. Comes in a 100-unit vials. And we'll typically reconstitute this with saline prior to us using it. So we have Ashley here today, who's agreed to join us for a Botox treatment. Ashley's had Botox before, but it hasn't been for quite a while. So all of her muscles are moving kind of in their normal way. And so today we're going to try to treat through here so that she doesn't get the wrinkles across her forehead, and then work on crow's feet areas and then her frown lines, so that even though she might be thinking she's frowning at her kids, they won't actually know. So when we're doing Botox, the first thing that we want to do is cleanse the face. So we're going to just gently clean with an alcohol swab in the areas that we're going to treat. We generally recommend that people, if you care, come in with some makeup so that you can reapply when we're done. Now that we've done that, we're going to go ahead and do Botox treatment. Now, this does involve needles and syringes, so if you're a little squeamish, probably time to look at a different video. So, let's begin. The way that we know where to put it is we have our patients make these expressions that we're trying to relax with the Botox. So, Ashley, let's begin. Show me a big frown like you're, there you go. Good. All right. And frown again. Good. Relax. Does that hurt?
It's a little pinch.
Yeah. Okay, frown again. And again. Good job. Okay, now we're going to treat your crow's feet. So I want you to squint real hard like you're trying to see something. There you go. Okay, and then squint real hard again. now we need to do some on the forehead in order to relax these muscles and help get rid of those lines. So now, can you hold up your eyebrows like this? Good. Up, one more time. There you go. So that's that. That's a Botox treatment. Lasts for about 3 months. No frowning for 3 months. How beautiful is that? It takes about 3 to 5 days before you start to see an effect, and then it's at its maximum at about 2 weeks. Did it hurt?
No.
Yeah. So we look forward to seeing you soon.